all, this is the new episode of Bright Eyes, Bright Lives, powered by Grewal Eye Institute. We have Dr. Vikram Khosla with us. Dr. Vikram, can we hear something about you?
I've been working as an ophthalmologist since '94. Basically, I'm a cataract surgeon and kind of glaucoma specialist, because these are the two main blinding conditions, one of the major blinding conditions in eye patients. Cataract is completely curable.
Okay.
But trick in glaucoma is the early diagnosis.
Okay.
So that we can start intervention as soon as possible to prevent it for making further damage to the eye. So this is a bit challenging and intriguing also. That's why I became interested in glaucoma.
And what is the common myth what patients have and they don't understand that it is glaucoma?
Myth about glaucoma, most of the patients, they get scared, they come to know that they have kala motia.
Okay.
So most of them are scared. Actually, there's nothing to be scared of. Go to the doctor as soon as possible. And now glaucoma is controllable. We have various methods to control it medically, as well as lasers and different kinds of surgical procedures. And we call it, now we have a mixed procedures where we have a minimal intervention glaucoma surgery. So glaucoma, there are a lot of advancements in glaucoma. Patient has nothing to be scared of now.
And if you have to explain glaucoma in one sentence, what would it be?
In one sentence, I can say it's a silent killer of your eye, because it gradually eats up your vision before you know about it. Because it starts eating your vision at the peripheral part of the vision goes off early. The patient doesn't know about it.
So this was my actually next question. Why is it called a silent thief?
Because there is no symptoms. No symptoms. It's a symptomless diminution of vision. Unfortunately, when the patient has his first symptom, there's already more than 50 to 60% damage of the optic nerve has occurred. So that is why we called it it's a silent killer. Yeah.
And if a layman has to understand what it is, how would you know? For example, if I'm driving, I can see something crossed me on the right, and I can see there's a scooter passing on the left, although I'm looking straight. So is this something related to glaucoma?
There could be some other reasons also, but visual field restriction in the initial phase are very, very difficult for the patient to perceive. That is why we always ask patients to go for a consultation, especially if there is a risk factors like family history of glaucoma, or if patient is diabetic, or patient has high myopia. So these are the reasons the patient should go for eye examination once a year at least,
okay,
so that the doctor can detect whether you are suffering from glaucoma or not. Because that's what the problem is. The symptoms are, the patient don't perceive any symptoms. No, like you were saying, hardly anybody who would notice that I could not see that pole crossing. Very few people who make this kind of complaints.
Okay. So the common man cannot understand?
Difficult, unless the disease is very advanced.
Okay.
Yeah. It's a painless, most of the primary glaucomas are painless, slow diminution of vision.
Okay. Okay, let's get to the fun element. I would want to ask doctor that if you were not a doctor, what would you have been? One I know, singer. Other than that?
I just wanted to be a normal human being.
One thing patients always say that makes you smile.
Oh, when they start, because I worked in Africa and there were patients who are blind for many years. Once you open their eye patch and start smiling and seeing this world, that made me really happy.
That's nice. If I can see clearly, my eyes are perfectly fine. Is it a myth?
It depends on which age group are you in. If you're above 40, then still you have to go for a consultation once a year. As I told you, glaucoma is one of the reasons, and there are other retinal disorders also, like diabetes or hypertensive retinopathies or some hereditary conditions. You should get your eyes examined. Yeah.
Is it a myth or a fact that only old people get glaucoma?
Mostly, primary glaucoma start at 40, 60 around, but it's not a myth. It can start at an early age. In children also we get congenital glaucomas, and in young patients also there are certain secondary glaucomas. So glaucoma can happen to anybody, you know.
Is there any one myth a patient has come up and told you about the eyes?
Myth about eyes?
Yeah.
Yeah, because they say that when we apply kajal, then eyes become, we see better, but actually it's not true.
And you see a lot of small children, babies, they're full of surma in their eyes.
That's not a good practice to have, not at all. It can damage your, if apply in the lid margins that block the meibomian gland openings and cause a lot of blepharitis and other allergic conjunctivitis. There's so many other things. Kajal is, if you want to apply it far away from the eyelid margin, not near it.
On a scale of 1 to 10, how seriously do people take their health, eye health?
In urban population, educated people, you can say around 7, but in uneducated and village population, they hardly maybe 2 or 3.
Because there's a lot of rural camps you do, so do you feel them they're hygienic when it comes to eyes? They keep it hygiene? They take care of their eye health?
Because of ignorance and lots of myths and local treatments they trust, maybe the lack of access to the better facilities, you know. So they are brought up in this kind of conditions where they don't, have the level of intelligence to make out when they should go for an eye check. That's the reason usually their disease get delayed when they come to us.
So when you go to camps and when you see children, what is it exactly you're checking in their eyes?
We're checking their vision, and we do autorefractometry and we do little retinoscopy to find out whether this patient has some kind of a refractive error or not. That's what we can see, and from the frontal glow we can make out a little bit whether retinas are normal or any other pathology. It's just a screening, but if you suspect something, then we ask the patient to go to the hospital.
Okay. So any one advice you would want to give to people and our viewers to have a healthier eyes?
Of course, since Dr. Grewal has made this beautiful facility, Grewal Eye Institute, Medicity, and it's a state-of-an-art hospital with a very, very low-cost facility for the population. They must come here and get their eyes examined, you know, and they'll obviously feel much better. That we can make sure of that.
Okay, and what is that one thing people should not ignore about their eyes? One symptom.
One symptom? Oh, it's a difficult question, but I can say if the vision is going down, they should go to the doctor as soon as possible. Don't ignore it.
Okay, and one thing that every patient should do regularly, or for that matter, every person should take care regularly.
Reduce your screen time, go to sleep early, get up early. That maintains your circadian rhythm of hormones. Try to remain stress-free and get your eyes examined on a regular basis.
Okay. So are you a morning person or a night owl?
Should I tell the truth or?
Whatever you say, sir.
Night.
And what do you prefer, glasses or contact lenses?
For myself? It depends on patient. Glasses are always better because they are not in contact with the eye. The people, for cosmetic reasons, they can wear with contact lenses, but I would prefer glasses rather than contact lenses.
What is your go-to stress buster after a long, long day?
Listening to music. I'm trying to sing also a little bit. That's
okay, and one-line message you would want to give to the listeners?
Don't ignore your eyes. They are the reason you are seeing all the beauty in this world. If the eyes have language, they would say that please get our health checked up on a regular basis. That's what I want to convey. And the Grewal Eye Institute Medicity is one of the prime centers you must visit. Thank you.
Thank you very much. Pleasure having Dr. Vikram Khosla with us. Thank you very much.
Thank you.